I'm saying.
Doesn't he look like old ninja? Holy shit.
Dr.
Old ninja.
Yes, I've Dr. Yes, I'm sorry.
Oh my
yes, I reviewed
God.
testimony of Dr. Curry. I reviewed Dr. Curry's reports. I reviewed
Oh my
Dr.
God.
Curry's
You guys see that? Like,
And what
How'd
if,
this
did you
happen?
review the deposition and trial testimony of Dr. Hughes?
Yes.
Objection, Your Honor, beyond the scope of the disclosure.
Dr. Blevins? Yeah.
I'll allow that.
Thank you, Your Honor.
Overruled.
Did you interview Mr. Depp?
No, I did not.
Interesting.
Did you request to
I
interview?
requested to interview Mr. Depp twice, and both times Mr. Depp and his lawyers refused.
Look at his face. This is so funny. He looks like a villain. Look at his eyebrows, that little crooked smirk, his wild hair. He looks like a villain.
Okay. Dr. Spiegel, I'm going to ask you some questions in
Look at
this
Johnny
case
laughing
respecting
at
your
him.
opinions and the opinions you have formed and the bases for them. And I'm going to ask you to provide me with, in a reasonable degree of medical probability or
Okay.
certainty. Can you do that?
Yes.
I think he can
Okay.
probably do that. Sure.
On what were you requested to analyze and opine in this case?
So it's fourfold. One, I was asked to opine about the risk factors
Opine.
that are associated with intimate partner violence and behaviors that are shown, risk factors that are shown in intimate partner violence to be consistent with behaviors that Mr. Depp has demonstrated. Two, I've been asked to opine about the acute effects on alcohol and substance use, and I mentioned that including mood, behavior, cognition, functional impairment. Three, talking about the psychological profile, if you would, of, is there a question? I'm sorry. Oh,
No.
Okay. Of psychological and
That was so
sequelae of patients who have
He was
suffered
spooked, wasn't
intimate
he?
partner violence and perpetrate intimate partner violence, and whether or not Mr. Depp's behavior is consistent with that. And lastly,
But you
about,
haven't interviewed
alcohol
him.
and other substance use disorders, their diagnostic criteria, their medical and psychological effects, psychiatric effects, their cognitive effects, and their functional effects. And I think I would like to just go with the jury one other thing. When we talk about, when psychiatry talks about substance use disorders, it's imperative to understand we're not talking about someone who rarely uses and happens to have a bad night. We're not talking about someone
thanks for
who
20 subs,
uses
thank
on a
you.
weekly basis and
Right.
has a bad night.
Okay.
We're talking about repetitive patterns of behavior that meet a list of 11 criteria that could be deemed mild, moderate, or severe. Because I think people get confused when they hear the word substance abuse, that they think of, oh, I may have used this because I used it twice. There is a whole criteria
nobody
of
thinks that.
behavior and sequelae and consequences that go with a substance use disorder. I'm not just talking about someone who will occasionally smoke a joint or smokes a joint or snorts
They
occasionally
both
coke,
did this.
okay, or has alcohol on weekends. So I really need to reiterate that, because I think when you look at psychiatric
That's true. They
behavior,
both used
you tend
drugs.
to
She
look-
admitted
people
to
look
that.
online and say, "My
She
gosh, I
was
have
on
all seven
cocaine
of
with
these,"
him.
right? And they,
Oh,
And they
that's
were
how you
sharing
get cancer.
medications.
Psychiatric
When you have a headache.
To go. So please, when I'm talking about this, I need you to understand, one, that's what's going on.
I need
As
you
I
to
told
understand.
about intimate partner
Shut
violence,
up.
It's horrible that anyone would strike
He gets
anyone,
paid by the hour.
okay? But again, we're talking about repetitive behaviors for means.
He gets
of
paid by the
control.
hour, guys.
Right. So that's real important to understand when
Yeah,
you're
he's
moving
being
forward.
very
I may
long-winded.
Say occasionally substance abuse.
Yeah.
But what I'm referring to is substance
Objection
use.
beyond the scope of the question.
Thank you.
I don't,
Sustained. Next question.
Thank you.
Dr. Spiegel, could
The
you
Wizard
please
Destroyer.
just summarize for the jury the conclusions you came to with your opinions, and then we'll take you
Anti-wizard.
through the specifics.
So in my opinion, based on my a review of the evidence,
Silenced.
based on my clinical experience, based on my publishing experience, based on my teaching experience, that Mr. Depp has behaviors that are consistent with both someone who
Teaching
has
experience.
a
What does that
substance
have to
use
do with
disorder,
anything?
as well as consistent behaviors for someone who's a perpetrator of intimate partner violence.
Okay, well, what about the second
How
one?
would you
'Cause we
know
know
that?
the first one.
I'm going to start with the impact of drug and alcohol abuse over time.
You didn't even
First
interview
of all,
him. You
based
admitted to
upon
that.
He
your
didn't
review
interview him,
of
by the way.
record evidence, what type of drugs has Mr. Depp used?
So Mr. Depp, and I'm talking about use, we're talking about a substance use disorder here. We're not just talking about use. Okay, so we are talking about alcohol.
Oh my gosh, shut him
We are
up.
talking about
Hourly.
amphetamines.
Hourly
We
pay.
are talking about marijuana. Mm-hmm. We are talking about cocaine.
Write this
We are
down. It's going to be on
talking
the
about
test.
LSD. We are talking about ecstasy. We are talking about opiates.
Look
We
at
are
Johnny.
talking about prescription benzodiazepines. And
Look
we
at
also
Johnny's
said
face.
about the abusability of Seroquel and or gabapentin and Neurontin. And we are talking about much of the time
So all of them.
concurrent use, meaning simultaneously.
No.
In your practice, do some patients suggest
Mega
to you
high.
that drugs and alcohol actually help them?
Mega pints.
So
Of course
I
people
think
say
it's
that.
patients who lack insight or are in the very early stages of recognizing they have a quote unquote problem will sometimes actually say that they have this medication actually calms me down. This medication makes me feel better.
Well, isn't that what it's
And
supposed to do?
in actuality, they may not
What?
acutely feel anything, but chronic and
It's supposed to
continual
have
use
some
will
type
take
of
its toll
effect.
on the brain. So the answer is yes, but again, people who have substance use disorders have lack of insight
confused.
and a lack of judgment about what's going on.
I guess substance
They're very
abuse.
poor moderators of their own.
What's the difference?
behavior.
Yeah.
Has Mr. Depp suggested, based on your review of the record evidence, that alcohol and drugs actually help him?
Yes, in a review of the evidence, he has suggested that alcohol, Xanax, I'm in the list of medications, do help. Although I will also tell you on review of
Of course
the
they help
evidence
somehow.
that there were at least 2 times I can remember
Wouldn't be
that
prescribed.
Mr. Depp was referring to at least short-lived periods of sobriety, and I cannot exactly tell you what that included. That both times he said that he functioned better and that he recognized that alcohol and drugs was at the root of his problems.
Now, there's been testimony that Mr. Depp is quite charming, both off and on the drugs and the alcohol. What is your answer to that?
So, again, let me put one thing clear.
I wonder what
here.
Johnny's
Yeah.
thinking.
I'm not here to impeach Mr. Depp's acting skills or his persona. He has way greater skills than I do in that. What I'm here to
Aw.
say is talk about how drugs and alcohol
not a
affect what
fan,
we
is
all
he?
have in common. We're all human beings. We can all only get so much, take
He
so
gets
much.
paid by an
and
hour.
Something is going to happen.
He gets paid
That's what I
hourly.
see every day in the emergency room, on the consult service.
Every hour he gets
patient
money.
Psychiatry. Bad things happen.
So the longer
Not
that he
because
talks,
of anything special,
the more
except
money he
we're all
gets.
Human beings, and
The
our
more
brains
crap
he
substance
talks.
abuse are not titrated. They're not regulated by the
Every-
FDA. We don't know what we're getting.
Uh-huh.
We don't know how much
Yep.
we're getting.
Keep it up.
There is no control over what makes it to our brain. So it is not the actor. It is not the persona. Okay? It is a person just like the rest of us who are human beings who will have these effects. And that's what we all share in common. Everyone in this courtroom shares that in common.
When Mr. Depp was in his relationship with Amber Heard, was he a polysubstance abuser?
What's he in? What substance abuse?
Polysubstance
Multiple.
abuse?
Poly is
Can
multiple.
you explain to the
Leaving
jury
your-
what that is?
Overruled.
I'm sorry,
Okay.
Go ahead.
Okay, so polysubstance abuse is the use of 3 or more substances.
I think it's hard to hear it.
Currently, he was. Even while I was getting ready for rehab on the island, he was. So, yes, he did engage in that.
Did Mr. Depp's drug and alcohol abuse affect him cognitively?
Yes.
You didn't
So,
interview
if
him,
nothing
so you
else,
can't
look at,
say that.
Dr.
You cannot
Blaustein,
say that. This is
psychiatrist
crazy.
Mr. Depp did a mini mental state exam on him. And as part of that mini mental state examination, you're
Are
asked
drugs
to remember
drugs?
3 words and then come back 5 minutes later and repeat those 3 words. And
Right.
in the meanwhile, you're getting other types of testing for attention and concentration and visual, spatial, and language. So other things that are being tested too. Mr. Depp was unable to recall any of them, and that is very unusual for a 50-ish year old male. I don't remember how old he was when he took that. Generally speaking, that age group should be remembering two
That's
or all three of those words. One, I do know that his lines were also fed to him by earpiece. Again,
How do you know
affecting memory.
this?
I did see in deposition, I'm sorry, video deposition about having to have questions. I don't want to say repeat as much as completely forgotten. So the
Oh my
answer is
goodness.
yes. And you know, any one of us who use alcohol and cocaine to that level of degree, and I'm talking about a severe level of substance use disorder,
yeah.
are going to have effects. It is inescapable because we all have brains that are malaffected by extensive substance use, and potentially sometimes less. But certainly what we're talking about here is extensive.
He's wasting
Okay.
the court's time.
What if
This is
any,
ridiculous.
anything did you observe
paid by the
from
hour.
the record evidence about
Exactly.
Mr. Depp having difficulty focusing, his attention span, processing, whether he could function as an actor?
So
Objection compound.
Compound is only if it's
Over.
It's like